So one of the things that we pride ourselves on here at Back to Balance Wellness Centers, as I said in my beginning statements, was top of the line technology. And one of the tables that we use is what's called a heel flexion distraction. Now, that shouldn't mean anything to you whatsoever other than asking me, Dr. Matt, what does that mean? Well, the tables are built with a lot of fancy schmancy things built into them. And the reason why we do that is because a lot of us have low back pain every day, whether we're sitting all day in front of a computer, which leads to a lot of discomfort. You're sitting down for 8 hours. It compresses your spine and your lower back. You get up and you're like, oh, wow, that hurts. This table is built to literally stretch your low back out. And we're going to show you that in just a second with our model. Miss Bethany is going to help us out. The table's literally going to move. And what's going to happen when we achieve that is the spine and the low back is literally going to stretch a little bit. The table is going to move, which is going to allow the nerves to have more space to breathe. And if you're like me, sometimes I wake up in the morning, I'm really stiff when I get out of bed. Sometimes I feel some sharp shooting pains going down into my foot or into my toe, maybe into the back of my hamstring. Well, the reason why that's happening is because the low back is compressed. We have to decompress that low back. So that's what this table does. The other thing this table does is it makes a really loud noise, and I'm going to show you that too so it doesn't surprise you. It's built with what are called drops. The drops, if you look at the table right here, you'll see it come up just a little bit. The reason it does that is because the table was built to use speed rather than force. Now, if you have anything in your head about stereotypical chiropractic, you're probably thinking of Rambo, you're probably thinking of Sylvester Stallone, you're probably thinking of Arnold Schwarzenegger popping somebody's neck. Those are very old school techniques, they're outdated. They still work for some people in certain situations, but obviously it's very exaggerated. So I want to show you how this table works a little bit differently. It does make a little bit of a noise when there's not somebody on it, so I'm going to show you once now before Bethany gets on the table, and I'm going to show you again. It makes a noise, okay? It pops up. The reason why is, again, we're using speed of the pop rather than force. So stereotypical chiropractic, a person will push really hard to get a bone to move. That's simply old technology. So Bethany, if you come lay down for me now, and this has every piece of the table, so for your neck, for your upper back, for your low back, every piece moves. So again, we don't have to use force to do chiropractic alignments. And I like to use the word alignment rather than adjustment. I adjust other things. I align your spine. So Bethany's laying down for us, and I'm going to show you one thing that we do. And I'm not sure if the entire table is in the picture, but what I'm going to do is I'm going to put her legs, her ankles, in a little strap. She's holding on to a, I don't know what you call it, a little bar, I guess would be the word. And we're literally going to decompress her low back, her lumbars, if you want to call them that. And again, we're going to put some padding between each one of the joints. We're going to allow that nerve to breathe better. So I'm going to strap her in here. And this table can accommodate people from all sizes and shapes, and depending on if you have any acute injuries or anything else, we can also accommodate that. Acute means an injury that just occurred. A chronic injury is an injury that's been long standing. So we're going to put her legs in this little table, and she's already holding onto the bar over there. And depending again on if she's got any low back issues or not, we could change the angle of this piece, as you can tell. So now it's at a little bit of a higher angle, which is going to give her more of a stretch. So as we do that, as you can tell, the table can move. Now what's happening is her low back is literally separating. Does it feel good?
Yes, it does.
So it's a very gentle, very subtle way to stretch the muscles in the low back, to open the joints of the lumbar spine, and to allow the nerves to have room to breathe. So as we do this for about 10 minutes, and we also have usually what's called muscle stim. Muscle stim is our electrical stimulation device. It allows the muscles to relax, and then we put ice or heat on the person depending on what their injuries may be or what their goals may be. So we're going to stop that. Normally we do this for about 10 minutes. So as you can see with the person on it, if we have this piece cocked up here, what I would do is I would find where that misalignment is and then simply thrust into that spot very gently, and the table would move. And that's how that works. We would do it for the neck, the middle back, and the low back. And then if the person had any what we call extremity issues, meaning elbow, shoulder, anything like that, knee, then we would take care of that as well.